Here's a headache case that I'd like to talk to you about, and this is unfortunately common, headaches being probably the third most common reason somebody calls me in my chiropractic office, low back pain and neck pain being number one and number two. 29-year-old female, not daily headaches, but multiple headaches per week as long as she can remember, at least since high school. The frequency was once every couple of days. For many, many years, now she's 29, so for many years she had headaches but no neck symptoms at all. That changed and shifted in 2018, where she started to get neck aches and stiffness first, and then she would get a headache following that. So she started putting the pieces together. Maybe this is something that's coming from my neck. That's what prompted a call to my office. In the summer of 2018, before coming to see me, she did not have a job for a couple of months. I pepper people about that, asking them about chronic stress or recent stress. So she said, I had a great summer, no stress whatsoever because I wasn't working, but there was no change in the headaches, so it wasn't that. She takes ibuprofen twice a week, but more in 2018, and it does help. Just as a side comment on ibuprofen, that's a lot of ibuprofen, a couple of times a week for many, many years, and it's not solving the problem at all, because as soon as the next headache comes, and then you have to take it again, and the next headache comes, and so forth. And it's interesting where many of us will accept taking long-term medications like that, even off and on as she was doing, and think that that's fine for a problem. But let's say in the case of chiropractic, somebody might try chiropractic for a few weeks or a month or two, and if it's not fully taking care of the problem, then they'll say, well, that didn't work. Interesting, as a little side note there. We also talked about the side effects of long-term use of ibuprofen, including death, including serious gastrointestinal bleeding, increased risks of cancer, and so forth. So keep that in mind. In 2017, she got a new bed, she got new pillows, she tried various other pillows. Good call on all of that, but unfortunately in her case it didn't help. Migraine headaches are rare in her case. She's only had 3 or 4 migraines, and all of them were in the past year. So things were getting a little bit worse, right? Neck symptoms started coming up and she started getting migraines. So she comes in to see me. Now I'm doing the evaluation of this 29-year-old, and sure enough, she has full neck range of motion. Nothing wrong with the neck. The neck looked really good. Compression tests, orthopedic tests, neurological tests. I looked at the cranial nerves, pupils, and everything. Everything was just fine. And she had various medical interventions prior to this, which didn't reveal anything. But what I did notice is when I stuck my fingers in the upper part of her neck, worse on one side, sure enough, this was very tender and it would increase the headache sensations, a very common clinical finding that we find. We took some x-rays of her neck. Now what we saw is, looking at the neck, it's supposed to have a nice curve from the side, and she had a reverse curve in her neck. So that would be like, you should have a nice curve in your neck like so, but hers was reversed in the wrong direction, like bending my finger in that wrong direction. And that builds tension, stress, and inflammation in the discs and joints in the neck. And buried in those discs and joints are nerve endings. So in her case, I diagnosed her with a cervicogenic headache. Cervicogenic headache, meaning it's caused from the cervical spine. The cervical spine is the cause of the irritation and inflammation, which then radiates pain up into the head. I have done many shows on this in the past. It's where the inflammation from the irritated structures of the neck go into the spinal cord. They talk to a special group of nerve cells there, which also supply nerve endings to the head, giving you the perception of a headache. Cervicogenic headache, I explained that to her in simple terms. She said, I've got it, I understand, let's go to work. Sure enough, we started with chiropractic treatments. Now in her case, she did not want to have manual chiropractic adjustments, so nothing that caused any sounds. She just received light force chiropractic. She received in-office and home traction to her neck to reestablish the curve in her neck, and she had daily spine exercises, which everybody gets. In 1 month, her headaches are 70% better. She only has headaches now once a week. They're less frequent, less severe, and the source, these are in her words, the source of pain is known. And that was huge for her to know, oh, now I know what's going on here. I'm very comfortable understanding my diagnosis and understanding that my headaches are caused from my neck. I can combat them, she said. I'm so thankful. But as she finished her thoughts here, I would ideally like to get the headaches and neck aches down to 0 times per week. So we're just getting started with her. It's a month in, 70% improved. We know we're heading in the right direction. And this is such a common and successful case. So if you know somebody that has headaches, or if you yourself are having headaches, consider a chiropractic evaluation. I'm Dr. Scott Fuller.